So I am a radiologist, having practicing radiology for the past almost 32 years in the city of Madras. I started my radiology career in the year 1985 as a student at the Barnard Institute, where I did my DMRD. Then I did my MD also at Barnard Institute, and subsequently started my career in radiology at the Apollo Hospitals, Madras, under the able guidance of Professor Arkad Gejraj. Then came out of Apollo and started my own private diagnostic center called Precision Diagnostics, which I ran it successfully with few other partners for the almost 25 years thereafter. Sold the company about 6 years back. Now I'm a visiting consultant at Isabel Hospitals, Mainapur. As far as my radiology career goes, I started it in the days of this darkroom radiography, when radiology was confined to some remote corners in most hospitals. It used to be a dark, dingy room where most house surgeons used to be scared to go there even. There used to be a red line which said danger, with the skull and the crossbones, keeping youngsters away from that department. So I have done a lot of darkroom radiology those days, and I have seen the growth of ultrasound, CT, MRI, PET scan during my career in the past 30 odd years. So I think I'm somewhat reasonably qualified to talk about radiology as it stands today. Radiology as a career path for young residents is probably one of the most lucrative from the point of not just financially but academically also, because most radiologists are in a way complete doctors. They still have to study their anatomy, physiology. They need to know a lot about surgical techniques. They need to know about all the branches of medicine, be it ophthalm, ENT. So as long as you're practicing as a general radiologist, you need to be a full radiologist, a full doctor involved in all the branches of medicine. Till about 2 decades back, radiology was not all that popular among youngsters, but almost for the past 15-20 years or 15 years and all, it has been the most wanted specialty, not only in this country but all over the world. If you look at the top 10% of the students have scored high marks in undergraduate, they all seem to choose radiology as a first option. I think the reason for such a thing is the rapid growth that radiology has gone through the past 2-3 decades. Also, the growth we can't attribute just to radiology alone, but it's also the growth in the electronics and the computers, which really led to the growth in radiology as such. And when I tell you about the academic part of it, we also have a variety of options to choose from radiology, because today a radiologist need not be just a general radiology. They could specialize into a neuroradiologist, a musculoskeletal radiologist, or an interventional radiologist, or do pure and simple general radiology, which covers most of the basic things. But as a financial option also, I told you it's an interesting option, because many doctors today don't seem to have a life of their own. But if you are a radiologist and not involved in the emergency practice of radiology, you could actually earn as much as any other doctors in other fields, but at the same time have time in your hands. If you have all that need is a good connectivity, and you could sit in some remote islands or play your golf or do your skiing, whatever you need, but yet do good work for the short hours that you could do online. So that's why I think radiology was very, very interesting for a lot of the young students today. And it is continuing to be so, not only here, as usual, all over the country and outside the world, outside India also. As a career option, yes, radiology is definitely one of the most interesting career options a young doctor can have. It is still growing. It is not, I would say it has not reached its zenith yet. Though it's nearing there, it is not reached. Because every 2-3 years, they keep coming up with newer and newer inventions. So naturally, you need to keep pace with all those. And today, sky is the limit when you are a super specialist in radiology itself. You could demand your fee, you could do extensive work and be very satisfied with your work. And at the same time, like I said before, have a good social life as well. Like there is already it is a second place outside the country, because there they don't call themselves as MRI specialist, they call themselves based on the system. Like for example, one person is a neuroradiologist. He wouldn't even report a normal chest x-ray. He'd say, I'm a neuroradiologist. He would probably see all CTs, vascular studies and MRI connected only to neurology. And similarly, there are guys who do exclusive musculoskeletal ultrasound, musculoskeletal radiology, where they do musculoskeletal ultrasound, MRIs and all that. But in this country, in my experience, we have not reached that kind of specialization yet, but I don't think we are far from it, because we are also having the same kind of problems which people outside the country have. So it's better to be a specialist in one field rather than a jack of all trades. You could be master of one thing. Ultrasound originally was a specialty as a part of radiology curriculum. Generally, doctors did not do that. But somewhere down the line, the radiologists themselves were not taking up ultrasound because they were more enamored by CT, MRI, PET scans and interventional radiology. And ultrasound, you must remember, is very, very, very operator dependent, unlike a CT and MRI, where the sections are absolutely very clear and any radiologist can report on those sections. But ultrasound is extremely operator dependent. So that also put off the radiologist to a certain extent away from ultrasound. But today they've realized that there are people from other branches of medicine coming into radiology doing, like for example, urologists have started doing urological ultrasounds. Musculoskeletal orthopedicians have started doing musculoskeletal ultrasounds. Cardiologists have already taken over the entire echo. Obstetricians are doing. So there is some amount of loss of practice for radiologists, and now they have realized that it is one field which they have let go and they are trying to get it back. So because of that, there is actually a strong resistance from Radiology Association to allow MBBS people to do. And for actually there is a court case going on where we have gone against that. Having said that, I fully agree with you that there is a gross shortage of sonologists or people who are capable of doing good ultrasound. So especially not so in the cities, but definitely in tier 2 or tier 3 cities. I don't know if they should be encouraged or they should be given a proper training and then allowed to do an ultrasound. Maybe ideal thing would be given a proper ultrasound training, because ultrasound today is one of the most important modality of diagnosis. They should not be misleading the clinicians who are going to treat. Secondly, another important thing we have to look at is this training, they should not be misusing it for sex determination. That is one of the major disadvantages.